Booze. For some, the temptation can be too much. For many, the only solution is quitting altogether. But researchers at the National Institutes of Health Clinical Center in Bethesda, Maryland, are looking at a creative way to combat, and in some cases even stop heavy drinking with medication.
People who drink excessive amount of alcohol, they typically actually care about the details a lot.
Dr. Lorenzo Leggio and his team at the NIH believe these details are critical, and they're putting their ideas to the test.
More than 60 people have visited this bar-like room as research participants. And while the location, the backdrop, even these bar taps are fake, the atmosphere and the drinks are real.
Alcohol, kept under lock and key, is administered to some patients, and the bar-like atmosphere helps monitor cue reactivity.
If you create an environment which is closer to the real world, you can study better behavior.
For some of his studies, Leggio is recruiting individuals who are not actively seeking treatment for their alcohol use disorder, and he wants to see how they react to boozy cues in this custom lab.
When people, in particular people with an alcohol use disorder, are exposed to alcohol cues, they have behavioral but also physiological response.
Medical equipment and cameras tucked away help track physiological signals. The team also takes safety precautions, including a rigorous screening process and overnight stays after the lab sessions.
The overall goal is to develop medications that can help people to reduce and or stop drinking.
Leggio is testing two possible medications. One is a generic drug called baclofen, which he believes could reduce stress-induced drinking.
The idea is to see if baclofen will reduce craving and drinking in the bar setting.
The other option is a ghrelin blocker that interferes with a hormone made by the stomach and affects appetite. With both drugs, there is an added challenge doctors don't face with most medications.
An important factor is to make sure that the drug is safe when given together with alcohol. People may still drink, or they could even relapse, even if they're taking the medication.
Even with some promising data, there is much work ahead. But patients who are not looking to give up their drinking altogether still seem to walk out of the trials with a different mindset.
Even if they don't want to reduce drinking, just naturally because they see doctors, they reduce drinking.
Jesse Kirsch, Northwestern News Network, Bethesda, Maryland.